And to follow that experience, we wrapped up our trip to Kathmandu. And on a personal note, I just want to thank especially Ali and Amit since they've been here. We've already shared so many experiences and talked about how mutually beneficial our travel and our trip was, and it means a lot. So we went on this crazy trip with Richard, and so I want to highlight our activities in Kathmandu. We attended and were happy to be invited to the Spine Conference, which was the first spine conference for the Neurospine chapter of the Nepalese Society. And the entire conference was an update on spine surgery. And I think you saw some of the pictures, or will see some of the pictures of how great the meeting was. We were honored to be invited by Professor Sharma, who Richard has developed this amazing relationship, and I think that's why it's such a special event for those that have participated, as well as Professor Amit Thapa from the Kathmandu Medical College. So we had a 2.5 days of a full set of both professional and personal events, and this is the brochure from the Spine Conference. We were fortunate enough to at least share our personal and clinical interests and expertises first at the Kathmandu Medical College on September 20th, and we all shared in some lectures and some cadaver models on some specific areas such as SI joint fusion, lateral lumbar fusion techniques, and it was an honor to sort of help some of the general medical officers and the residents and spine surgeons from across Nepal who had attended that. We had a special section on minimally invasive spine surgery, and again got to share our clinical knowledge and our expertise. And you know, I think as neurosurgeons that give talks and lectures, we do it all the time, and we think that's great, and that's how we give back. But this was really the smallest part of, for me personally, giving back. The modules of workshops were spectacular to have that interaction one-on-one with the local neurosurgeons. And probably the funniest story, and I'm surprised, where did he go? I'm surprised Farouk didn't share it, and I'm glad there aren't any pictures of watching a slightly overweight U.S. neurosurgeon trying to get into their scrubs. I was probably sweat off about 5 pounds by the time I got those scrubs on for us to go into the operating room. So our second day, we got to participate in the conference, the formal conference at the Hotel Schenker, and again got to share our experiences on specific topics such as cervical disc arthroplasty, outpatient spine surgery, and just a quick story. You know, in the U.S., we think so much about moving inpatient spine surgery into the outpatient world and all of the benefits from the standpoint of patient care and resource utilization and insurance reimbursement and all that. And we realize, I realize that when we go to these other countries, they don't care about that. That's not important to them. You know, patients stay in the hospital for days and weeks at a time because culturally and financially, that's the right way to do it. And so I learned a lot just from sort of picking the topics that I selected to talk about. You know, I'm the expert on this and expert on that. And next time, I'm not an expert. I'm just there to share my knowledge as a neurosurgeon. So that was very eye-opening. But we got to hear, and I certainly learned from all the speakers, some of the things that they're interested in, including hyperlordotic cages and lateral fusions. I always learn something about medical legal stuff from Rich. And these are some pictures from the conference. My favorite really is the top right, where we got to share a lot of time with some of the younger surgeons and neurosurgeons and medical staff officers, those who are looking towards a career in neurosurgery. They haven't even really begun their career. And it was really exciting to just see the energy and the enthusiasm of their attendance to this conference with a lot of big-name neurosurgeons in that part of the world. For me personally, the most valuable part of the trip was our day spent at Tooth with Amit and the entire team. There you see on the left, we participated in their sort of morning daily report and grand rounds. I got to sneak away with one of the junior residents, and he actually took me through the unit and showed me some of the patients that they were caring for. And for those neurosurgeons in the room, think about this. In one room on the neurosurgery ward, there was a teenager myelomeningocele post-op patient. There was a pituitary macroadenoma patient post-op. There was an odontoid fracture post-op. There was a massive head injury.
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.